Hi, I'm Dr. Nicole Vane of Moonlight Beach Dental, and I wanted to talk a little bit about sleep apnea, airway, and your bite. So I dabble in all of these topics when you come in for a new patient comprehensive exam. I do a full examination on your airway, on your bite, and also on any health issues you may be having that are related to those two things. I look at your tongue posture. There's a lot of people that have tongue ties that have never been diagnosed. But the question is whether or not we need to do anything about any of these things. So, when I look at airway issues, like sleep apnea, essentially a lot of people clench or grind their teeth because they have a tongue tie where their tongue is falling back and blocking their airway, and their airway becomes like a kinked garden hose. So picture that, picture a kinked garden hose. So what they do is they want to jut their jaw forward to straighten out the garden hose, which is your airway right here. Now, between solving the issues of the narrow arch and the tongue that's in the wrong position, there's a lot of steps that we may need to do and address if you want to actually correct that. But the overall impact on straightening out that kink garden hose is more airflow, more energy, feeling more alert, not having brain fog. Those are really important things. Now, sometimes people have done a lot of damage to their teeth from acid reflux that comes from a pinched airway, from grinding their teeth that comes from a pinched airway. And a lot of times what I'll do then is something called a full mouth rehabilitation. I've posted a lot of pictures recently of cases I've done where I've rebuilt someone's entire mouth, and we do what's called opening the bite. We take the flattened narrow arch and we actually make the teeth taller and broader so we can create more tongue space. We don't actually do anything to the tongue in a lot of these cases, but we create more tongue space so it's not falling back and kinking that garden hose and blocking it. So there's three things that we look at whenever you're here as a new patient or for a bite evaluation. The first is the airway, like I mentioned. The second is looking at your tongue posture to see if your tongue tie is what's causing all of the bite issues, and also if it's causing other symptoms like mouth breathing or acid reflux. The third thing is when we do a bite analysis, we do advanced 3D imaging. We do a 3D cone beam x-ray, and we also do a 3D scan that does a jaw analysis where I can show you digitally exactly what's going on with your bite and show you your wear pattern. And also, even if we don't do treatment, I can monitor that data each time you're in and see if anything's changing or getting worse. So we look at all those factors, and then we talk to you about your options on how we can fix your airway or fix your bite using a variety of techniques. So if you find yourself undergoing any of these issues, feel free to check us out here and come on in for a consult at Moonlight Beach Dental.